Hi, my name is Dr. Neil Thompson. I'm a chiropractor. I was recently introduced to Marie and the AtlasPROfilax adjustment, and I've certainly been very impressed with what they can do, especially with the machine they've got and with Marie's experience in determining exactly where an atlas has subluxated and how best to try and readjust it into its normal position. Atlas obviously is a very, very important bone to have positioned right. The rest of the spine really is dependent upon an atlas being in the right position and motion and being able to move properly, and when the atlas doesn't, the rest of the spine really suffers and abnormal motion happens throughout the rest of the spine in form of compensations. I think a lot of chiropractors really struggle to get to adjust the atlas really effectively, and I've certainly, when I've been introduced to Marie, and certainly from the feedback I've had from some of my own patients and my own experience when I got it done, I was very impressed with how much she is able to readjust it into the correct position, and just the kind of effect that that then has afterwards. Machine is very powerful, can get in really deep, because I think she works on the muscles surrounding the atlas. She's able to relax the area enough for that atlas to move much better into that right position, whereas when you're trying to do a high velocity thrust directly onto the atlas itself, it's a bit more difficult, and I think often we are able to relocate it to some degree, but just I think not to the degree that the AtlasPROfilax is able to do. I've been very impressed, and I think I'd love to be able to work with someone who does this so that I can then focus in on the rest of the spine and nervous system, knowing that the atlas is actually being set well. So whilst we are able to do certainly some very effective atlas movements and adjustments, AtlasPROfilax I think makes for a great adjunct to that, to really get in a deep effective adjustment to that area, and hopefully then that'll then stay there until such time as the person suffers another trauma. Yeah, I think I would certainly like to be able to work a lot more closely with people who do the AtlasPROfilax type adjustments, because I think it complements chiropractic brilliantly. And I think at the end of the day, it's not really what profession gets people well, it's getting people well. And the outcome is the most important for the patient, not who actually does it. So I think the more we actually use each other and the more we complement each other, the better the result will be for everyone.